Hi all, I'm Dr. Malati, working as a professor in Trippuram College of Nursing. In this video, we are going to discuss about the mechanism of labor. So under the mechanism of labor, I have discussed previously six mechanisms, that is LOA, ROA, LOP, ROC, then LSA, RSA. And this is the seventh mechanism, LMA, which is nothing but left mento anterior. So this is going to be a demonstration procedure for both the MSc Nursing post basic and for the BSc Nursing students. The objectives are introduction, definition, principles, characteristics, movements, summary and conclusion. Introduction. Mechanism of labor in left mento anterior refers to the sequence of movements that occurs during the delivery of a fetus presenting by the face with the chin, which is nothing but the mentum is the denominator, that will direct it towards the left anterior quadrant of the maternal pelvis. So here the presentation, you will call it as face presentation. It is considered as a rare presentation where the fetal head is fully extended. So in left mento anterior position, the vaginal delivery is usually possible because the chin rotates anteriorly under the symphysis pubis, allowing the head to be delivered through the birth canal. Mechanism of labor. Definition. As the fetus descends, the soft tissue and bony structure exerts pressure which leads to the descent through the birth canal by a series of movements. Principles. So totally we have three principles. First principle is descent takes place throughout the labor. Whichever part leads and first meets the resistance of the pelvic floor will rotate forward until it comes under the symphysis pubis. Third principle is whatever emerges from the pelvis will pivot around the pubic bone. Characteristics are, totally we have six characteristics. So under this face presentation, we have the lie is longitudinal, presentation is face, position is left mento anterior, the attitude is one of extension of the head and neck, the denominator is mentum and the presenting part is left malar bone. First movement, extension. Here, descent takes place with increasing extension. The mentums become the leading part. So, the descent of the fetal head into the pelvis often begins before the onset of labor. For primigravida, usually descent takes place 2 weeks prior to the onset of labor, and for multigravida, on stage of labor due to the muscle tone is relaxed. Therefore, the descent and engagement of fetal head may not occur until the labor begins. So, due to the increased contraction and retraction of the uterine muscle, the exerting pressure on the fetus to descend, followed by rupture of forewater, exertion of maternal efforts, and progress speeds up. Next movement is internal rotation of head. Chin reaches the pelvic floor and rotate forward 1/8 of the circle. The chin escapes under the symphysis pubis. Flexion. The sinciput, vertex and occiput sweeps the perineum and the head is borne by the movement of flexion. Next movement is restitution. The chin turns 1/8 of the circle to the women's left. Next, internal rotation of the shoulder. Shoulder enters the pelvis in the left oblique diameter. Anterior shoulder reaches the pelvic floor first and it will rotate forward 1/8 of the circle along the right side of the pelvis. External rotation of the head. The chin rotates 1/8 of the circle towards the left side where it is started. Next movement is lateral flexion. The anterior shoulder escapes under the symphysis pubis. Posterior shoulder sweeps the perineum and the whole body is borne by the movement of lateral flexion. Summary. The mechanism of labor in left mento anterior includes engagement, descent, internal rotation of the chin anteriorly, delivery of the head by flexion, restitution, external rotation and expulsion of the shoulder and body. So successful vaginal delivery depends on the adequate pelvic dimension and proper anterior rotation of the mentum. Conclusion. Left mento anterior is the most favorable position in phase presentation for vaginal delivery. Understanding its mechanism helps the nurses and midwives to monitor the labor effectively, identifying the complications early and providing the appropriate care to ensure the safety of both mother and the baby. Thank you. References.